As professional government asshat Rahm Emanuel says, citizenship is not an entitlement program. Governments want to make sure you can bear the responsibilities of citizenship before they can provide you with the benefits. It's a trade-off. Ideally, we don't work for the government, nor do they work for us. There's supposed to be a mutual exchange going on. But that mutual relationship gets distorted when the government makes us buy identification cards, health insurance, etc. It also gets distorted when government makes insurance companies behave like charities, like by making them take pre-existing conditions out of their risk assessments, and making charities behave like insurance companies, like by creating welfare programs that can drug test you, which may be up the road. The agorist's ideal world would resemble something like this. Agencies providing some protection, like personal security, health insurance, home, flood, fire, unemployment insurance, etc., would be free to assess the risks involved in insuring their customers. Whenever someone has trouble affording those services, charitable agencies and volunteerism would pick up the slack. There would be no government involvement distorting the insurance market, and everyone's needs would, hopefully, be fulfilled, given enough social and moral pressure on the wealthy. To make up for the deficiencies of such pressure, consumers would have enough clout in the market, due to lack of government bailouts, due to lack of government, to prevent the charity and the protective services which are most popular in the market from benefiting the wealthy, at least the parasitic ones who don't produce anything, like career politicians and military-industrial complex assholes. I object to the characterization of Obamacare as handing healthcare over to the insurance companies because, as much as it gives preferential care to people who are already insured, it requires insurance companies to insure people with pre-existing conditions and keeps the system of government privilege for an oligarchy of insurance companies. Essentially, healthcare was handed over to the insurance companies decades ago. Obamacare just kind of entrenches things. Obamacare was sold to the American people as health care reform, not health insurance reform, which is what it was. The care aspect should be emphasized. Bottom line is, health care is a scarce resource. Universal or equal or socialized distribution of a scarce resource inevitably leads to decreases in quality, quantity, or both. If we accept that principle as a simple law of economics, then we will understand that universal coverage will cause, unless and until some miraculous increase in health education and production of nurses and doctors occurs, 1. Health insurance prices to go up, and or 2. Distribution of medical equipment and care to go down, and or 3. Medical colleges and the American Medical Association to raise their standards, which now serve as artificial barriers of entry into the medical profession. Basically, if you want universal health coverage, you have to choose between either 1. Higher rates, 2. Shittier care, or 3. Slightly higher rates and slightly shittier care.